Hi everybody, Azar, physical therapist. Today we're going to talk about the next deformity of the hip, which is actually the most important deformity that can cause a lot of other issues. Actually, the leg discrepancy, or one leg longer than the other side on the kids, usually starts from the very younger age, like from even newborn time. And then if they don't diagnose it when the newborn gets delivered, and a couple days after, they usually cannot do much. Maybe after like a couple months they can do more, and then after a couple years we have to deal with the leg discrepancy, okay, if it's left untreated, and later on in the life we have to deal with other stuff, okay. So now I'm going to talk about that dislocation of the hip, which is congenital. We call it CDH, congenital dislocation of hip. You might get freaked out when you deliver the baby, and then the doctor is just trying to move the hip and then do all kind of maneuvers on the newborn hip, and then you say, what is doctor doing with my baby? They're actually testing your baby to make sure they're not born with the congenital dislocation of the hip, because if they don't diagnose right away, it's going to be harder to treat later on, very hard, and maybe the surgery and other stuff. So basically we're going to talk about this today. Now, the congenital dislocation of the hip is when the hip is actually the femur bone gets off the socket for some reason when the kid born, basically. Sometimes it happens after the kid's born with some kind of mismanagement of the kid, but usually on the baby, but usually it happens right after the baby born. This is what can show you the congenital dislocation of the hip. You see that nice femur located inside that socket, right? That's the hip socket right there, and that's the femur head right here. You see how it nicely located inside? That's the healthy hip. And you see this one, it's dislocated, right? So that's the fossa, and the hip socket is trying to get that get itself ready for the femur bone to goes into, but the femur bone's out of the way, is not really here, so it's outside. So what's happening in that? Imagine these two babies. Which leg's gonna be shorter? You tell me. This leg's gonna be shorter. Why? Because the hip is off the socket. Socket's actually here, and the head of the hip's here. So the hip is going very short than the other side. So how the doctor can recognize that? They have specific tests. One test is Barlow test. I'm just showing you. Probably you don't want to do it on your baby. Just the doctor should do it. But don't freak out if the doctor is doing that. They're not trying to hurt your baby. So basically, they open up the baby's leg, okay, and that's supposed to be inside very nicely inside the socket when it's opened, or abducted the leg while the baby's laying down, and then they bring the leg inwards, right? And they close the leg. What happens? You see that? It's in the socket. Now it got off the socket. Boom. What happened? That baby has a CDH. And then they usually hear a click at that. So how they confirm it? They try to relocate it back. Of course, they have to relocate it back because they just dislocated your baby's hip. But they didn't mean to. They just did a maneuver, and then it turned out that the hip's weak inside the socket, so that it got dislocated. No, they try to relocate it back to make sure they confirm that. They open it again. This is dislocated already. Now they do ortholani test to relocate it back. They put this inside the socket by opening that leg, and then boom, the head of femur goes inside the socket back and probably clicks. And then your doctor have to tell you the news. Your baby has a CDH. Okay, that's not the end of the world. Your baby has CDH, but they can do a lot about it. First of all, if it's left untreated in the first days or first month, that's the worst, because later on, leg discrepancy, one leg longer than the other one, and then not correctly form that fossa. The fossa has to be deep to be able to hold that inside. If the if it's like it has been outside in the uterus, the femur was outside, then it didn't have enough opportunity to get pushed to that fossa. And then the fossa is probably very shallow, it's not deep. So we have to make it deeper now that we have a chance. Because the baby in the first days and first months still growing, we can still be putting the pressure, we can actually deepen the fossa. That's amazing, right? So that's why you have to catch it early. But if you wait, then you have to go by the surgery and try to crave that and shape that bone to make that fossa deeper for the head to be able to get in. And they probably have to fix it with some kind of a screw even, because they're not going to stay in. But the simple way of doing that, so just more diapers. More they tell you probably to put a lot of diapers in the baby all the time. Keep the leg of the baby abducted. So you have to keep the leg of the baby like that for like basically a whole time, even at night. It's going to be a very hard, very hard job for the parents. But if they don't really pay attention to that stage, then they're going to have to deal with it for the rest of the life of the kid. So imagine that if they tell you that to put a lot of diapers and keep it open all the time, you have to really follow it, because if not, later on you're going to be in trouble. Another things that they can do, if the parents really cannot follow all the direction, what they can do, they can just give you this basically, some kind of bracing. Some kind of bracing can be given to the patient to keep that hip open. So the bracing will be really crucial to have it an abduction, and it's gonna be like the brace that opens the legs, and then keep them in that position. I'm gonna try to find it for you right here. Like this one, okay? That's a brace. The feet, the legs goes here and the back goes here, so keep the baby in that open leg shape. Or even like this, it can show you diapers and the brace. These days they usually do put the brace because the diapers will not do the job, and the parents cannot really be compliant with their putting a lot of diapers. It's going to be hard, so they usually put the brace in there, okay? And then kids has to be there for months, and then they keep checking the hip x-ray, and then keep seeing that if the acetabulum fossa is getting deep enough so that they can take it off. So great. If your baby though did not get diagnosed with it early age, so how they can be diagnosed this way? They probably should do that test now. That test is called Galeazzi test, and then that's like this. So you have your toddler lay down on the back and bring the knees bent. So you look at the top of the knee on both sides. If one knee stay higher than the other side, you already know that, oh, we have a leg discrepancy, so it clicks. It might be the congenital dislocation of hip, might be something else, some other hip. Usually it's a hip issue, growth plate issue, but could be other hip issue. But most likely the CDH. So what you look for the lower leg. The lower leg should be the one that gets treatment. The leg that stay higher, that's normal. As we said, the side that's dislocated is usually shorter, right? And then you can look for in your baby that if they open, they have some clicking, cracking, and then they don't like to open the legs and all kind of this. Yes, then you have to really take the kid to the doctor along with that test that you can do at home. Very simple test. You don't have to do the maneuvers like the Ortolani or Barlow test that was scary to dislocate and relocate. You just look at the baby just that. Have them lay down, looking at the knees. Simple, right? And if the baby have any of these tests positive, like not the baby, at this point it's probably toddler or even more, like maybe 3-4 years old or more, there still has be a chance to correct it with the exercises, and if it's not too much difference, they can probably do that. And they can probably relocate and try to brace it and all kind of things. But if the kid's grown already, then they probably have to do surgery to make that fossa and shave it, make it deeper, so it doesn't keep dislocating on the baby. So if you figure out that your patient, your kid has this, then the next step, of course, go to the doctor, and the doctor probably relocate or do something for it and make it even, and then you should not have this leg depth discrepancy later, hopefully. But another thing that can be a very bad red flag for your kids to have some kind of deformity is the way that they sit. If your baby has a CDH, they probably like to sit very weird. They don't want to open one leg. One leg they like to open, they're okay with. The other leg they cannot really like open it. So just try to make it like this or close, or they don't want to open. When they sit crisscross, they do uneven. They like to deal with this leg, but they don't want to deal with the other leg. So that's another way of recognizing the baby have CDH, congenital dislocation of the hip, and then later on, after you fix that alignment issue, which is the first step, with either bracing, too much diapers, or later on with some relocation and surgeries, then hopefully you can start doing physical therapy, because the leg that's shorter is probably already weak. And then we have to strengthen that, and I'm going to show you how to strengthen that hip in the next level. Okay, thank you for watching. That was just diagnosis, very important one. You can self-diagnose your kid and then take them to the doctor if it's not diagnosed by the doctor when they born. Thank you so much and have a great day.